Thanks everyone who is just starting to file in. We will be going live with today's discussion in just about a minute and a half, so hang tight as we get settled in. All right, looks like folks are starting to file in. We're going to give it another 30 seconds because we've got a lot of folks who are just logging in. We want to make sure everybody's got their sound up and they're able to hear and see everything that we're talking about. So we'll just give another few seconds and then we're going to go ahead and get started here. So it looks like we've got a quorum. So we're going to go ahead and get started. Welcome everyone, and thanks for joining us. It is March 4th, 2021, and today's One Good Night Experiences of Patients and Families Across the Lifespan is our 4th episode of the Solving for Sleep series. The series is made possible through PCDC's partnership with the SAMHSA Center of Excellence for Integrated Health Solutions, and we thank them and you for your support in this series. If this is your first time with us, I'm Andrew Phillip, a clinical health psychologist and the clinical lead and senior director for partnerships here at the Primary Care Development Corporation. Next slide. And again, if you're new to us, PCDC is a national nonprofit founded over 20 years ago to enhance health equity in underserved and frankly, disinvested communities. And since 1993, we've done this through capital investment to the tune of over $1.2 billion to enhance healthcare infrastructure around the country, through advocacy and research to build policies that actually support enhanced and sustainable primary care services, including behavioral health, where they're needed most, and through training and technical assistance like today's webinar, as well as consultation on everything from patient-centered medical home accreditation to primary care behavioral health integration, HIV prevention, care management, reproductive health, and more. Next slide, please. So we do have to do a quick disclaimer, as always. The views discussed here today and really throughout the series are those of the presenters, and we have to let you know that they do not necessarily reflect those of the Center for Mental Health Services, for SAMHSA, Health and Human Services, or any other federal entity. So let's get to it on the next slide here. In this series, our goal is really to further the movement of physical and behavioral health integration to enhance access to services within a really whole person model, a biopsychosocial approach. We're honing in on almost a universal pain point, and that is sleep. We have been examining the impacts of sleep on mood, on health, on overall well-being, and also the roles of care teams, of interdisciplinary, multidisciplinary, and transdisciplinary teams, and listening to and partnering with patients to enhance sleep health. And really to develop a core set of skills in this area. Next slide. So earlier this year, we reviewed some of the foundational components of sleep health. We heard from industry experts on what they've been seeing related to addressing things like disparities in sleep and access to care. Last month, we really honed in on behavioral assessment and treatment for insomnia using cognitive behavioral therapy for insomnia. Later this spring, we're going to get into the physical and medical components of sleep. We'll be talking medication, sleep studies, medical intervention for sleep. And as you'll see on the screen there, in May, we'll wrap with a session dedicated to those of us that are in caregiver roles and the importance of addressing our own sleep needs. You can find all these recordings and also registrations and more at pcdc.org/sleep. But today's really a discussion that we have, and I've been particularly excited about. And in a moment, I'll be introducing our panel of experts. But first, I invite you to really pause and join us in your focus and also your intentions. Our guests today will be sharing their true and quite personal experiences with their own experience in living with sleep-related conditions, what it's been like getting treatment, and generally getting real about life with and also without quality sleep. Our panelists are sleep experts in the truest sense of the word, and I ask that we honor them with our attention and also our curiosity. And I want to be clear, some of our discussion today may be triggering or even painful as we hear about their and also our very human experiences. But I also suspect that we're going to find inspiration in their messages and also learn from their feedback about how we can really seek and provide the best care possible, all while also being fellow human beings in this world. So we have 90 minutes today, and we look forward to you through our chat and through the Q&A that you have at the bottom of your screen there to share your thoughts and questions for expert panelists. Today's session is being recorded and will be available at pcdc.org/sleep, and you'll receive information about that through email after today's session. So we'll head to the next slide. And first, I really want to hear about you. So let us know, and the poll's going to pop up for you in a second here. What type of setting do you work in, and what is your primary role? If you are in a sort of other category, if you don't fit into one of these little sort of neat boxes, I'm especially interested in hearing about you. I'd love to hear, and you can use the chat box, and you can actually select all panelists and audience so everyone can see if you don't mind, but let us know who you are, where you're from, and what you do, or what your interest here is. It's great to see that. So we'll give a few seconds in the chat. And again, you can use the chat to let us know more. Let's see, so we're getting folks who are already starting to chime in here. So we've got folks at community health, behavioral health consultant for primary care. Love to see that. Program managers, high school setting as a school social worker. Yes, we're going to be hearing about some of the youth perspective. It's great to see you here. A health plan educator, excellence. We've got folks from Arizona, from DC, nurse educator in rural critical access hospitals. Yes, this is so important. We know that access within rural settings incredibly important. We've got quality improvement folks, RNs, nurses for public schools, integrated health, juvenile probation officer, trainers in behavioral health and substance use, educators, a college student in psychology class. Yes, welcome. Wellness prevention department, health systems, group coaching, folks from New York, peer support specialists, excellent. Really happy to see peers, community health workers, folks with lived experience joining us, trainers, substance use counselors, CCBHCs, welcome, our good friends in CCBHCs, folks from FQHCs, wellness coaches, capacity development facilitators, crisis counselors, yes, pediatric nurse practitioner. All right, keep them coming. This is great to see. We've got a really diverse audience here. Looks like 63% of you are in behavioral health, 26% in sort of an integrated care setting, about 11% of folks in traditional primary care. And we've got a pretty interesting mix of people who are therapists or nurses, care managements, but really our second category is other, and that's all the folks in the chat here. We're seeing lots of peers, disaster mental health volunteer, Red Cross. This is great. All right, well, welcome everybody. Keep them coming. We're going to keep going through our agenda here and keep using the chat to let us know about you. So we're going to head over to the next slide, and we're going to start off today actually with a brief 5-minute or so video with a few drop-in guests who couldn't quite be here today, but wanted to share their experiences. So listen in for a few minutes, and we'll keep the discussion going just after that.
I think it's important, one, because it allows people to be able to have they have better performances in school and work, and both physically and mentally. And it allows them to kind of have a time of rest and relaxation. It also allows them to wind down. And I think that if you have more sleep, you'll probably be more energized the next day.
It can sometimes be hard and sometimes be easy and sometimes just feel good. Personally, I get hot in bed and I can't fall asleep. It's very annoying, but it always feels good to wake up in the morning and have a fresh start after having a good sleep. And that's what sleep basically means to me.
Let me think. Well, I don't really like sleep.
Well, I don't really like sleep.
Yes, I like sleep. I'm able to kind of like, everything that's happened that day, I can kind of just like be able to calm myself down and then be able to put everything that happened that day behind me, and then I can be ready for the next day. It gives me, like I said before, more energy. I do soccer and dance, so that really does tire me out. So whenever I do have sleep, it makes me not feel so tired. Sleep also helps me be less stressed. I get really stressed easily, so being able to go to sleep helps with that a lot.
That's actually a pretty hard question because I like sleep. I like to go to sleep, but a lot of the times I'm hot or I have trouble falling asleep, and it's hard for me to fall asleep. But if I didn't have that, I would actually pretty much like sleep unless I had slept a lot during the day. And I didn't need to go to sleep because I didn't want to, and I didn't need to because I had already slept a lot. But with us, we don't really do that as much because we have like a programming into our brain with sleep.
Yeah, because I'm lonely.
You're lonely?
Yeah.
It depends on the day. Sometimes, well, say one day I have like soccer games. Since I've been running, then I'm probably gonna have an easier time going to sleep. But if I didn't have any after school activities that day, I'd have a much harder time going to sleep. Probably due to the energy that's still built up in me. And then whenever I'm in bed and I still have energy, I end up, well, when I'm not tired. And two, I end up just having a lot of random thoughts that like pop in my mind, laying there in bed with a bunch of random thoughts, keeping me awake at night.
I'd say in the winter, it's medium, sometimes easy, but in the summer, I'm always hot, sweaty, itchy, and it's hard, very hard for me to fall asleep.
Word.
I actually had a mini breakdown at school because of how sleep deprived I was. I had like soccer games, soccer practice, dance, and I wasn't getting home until like 8:30, 9 o'clock p.m. And then on top of that, I still had to do like homework and eat dinner. So I was only getting like 4 or 5 hours of sleep every day that week. And then on Friday, I guess it kind of caught up to me because I had a mini breakdown in class where I was crying. Probably because of how stressed and sleep deprived I was. Yeah, even my teacher said that they noticed in the following days, or the prior days, I guess, how they could see how like I was like tired, really tired.
I'd say sleep. It affects me a lot actually. I can be tired or not tired if I haven't had enough sleep. But it can impact my day and probably a lot of other people's days very hard if you don't get enough of it. And if you get enough, your brain works a lot better, but if you don't get enough, it's a lot harder to do the things that you need to do.
What does that mean?
That's a great question. So it means, do you feel different based on if you sleep well or not?
Well, when I sleep, I don't really feel anything.
But in the morning when you wake up, can you tell if you've slept a lot or slept good?
Sort of, because I don't know I'm asleep when I'm asleep.
Right. You don't know you're asleep when you're asleep.
So, but only sometimes. So, just a little bit. So just sometimes.
Say bye.
Bye.
Well, so thank you to our guests, our young guests here, and also I'll just say a shout out to our real producer and also informal kid wrangler, Kristen Potterbush, who's been working behind the scenes here for producing this, and of course to our parents who contributed these videos. So we don't always take kids too seriously, frankly, when it comes to their real own sleep concerns. But it's a real perspective that someday they grow up and they become us. And those trusting relationships that we build with children around sleep and that we either validate or don't validate in the care that they receive, it helps to really shape our orientation to sleep as adults. And so, we want to include this perspective and not overlook it. So we're going to move forward here and kind of be joined by our live panelists. And so without further ado, we're going to hop to the next slide here. And I'm going to introduce our expert panelists who have kindly shared some brief bios with us. First, Elizabeth Burnham McIntyre. She's worked with the public health and public policy sectors for over a decade. She focused her career on addressing the diverse complexities of poverty policy. Elizabeth worked on systems that help low-income communities access safe and affordable housing. She's advocated for culturally competent and equitable care for American Indians and Alaska Natives living on reservations, and developed outreach strategies and internal system design to ensure that all persons have access to quality, affordable healthcare. She's navigated the healthcare system both personally and professionally, and welcomes the opportunity to share her own lived experience in the hopes that it can support others in their journeys to better physical and mental health and well-being. Next, Eugenia Brooks. She's a former business professional and social worker, and who shares that she has been disabled by invisible health issues while flourishing in a new normal as an aggressive patient advocate and blog writer, currently with the American Sleep Apnea Association. Welcome, Eugenia. And finally, Matt Gentry. Matt brings his own incredible contributions as a self-described sleep advocate by day and sleep apnea man by night. He's using his incredible story to help share and inspire the world to improve the quality of their sleep. Liz, Eugenia, Matt, thank you for joining us today and for sharing your knowledge and experience with us. Thank you for in our prep discussions, giving me a little permission to poke around a bit and to guide our conversation. To start, again, thank you for being here. I'd like to hear from each of you, and Eugenia, perhaps we can start with you. If you can sum up in a couple of minutes, what's inspired you to be here today, to take this time out, and what would you like to see come from the conversation we're having?
Well, Andrew, thank you very much for having me. I wanted to participate because I always try to support anything towards good health. Having become disabled taught me the meaning of a saying my grandmother used to always tell me about, how without your health, you have nothing. And, I lived so much of my youth and early years taking my health for granted, because that was the one thing that I could count on. And then to have it fail me so suddenly, and everything I lost everything as a result. It hit me fast, and you're never prepared for something like that. And so in my recuperation, okay, I decided that my best next move would be to be there to help people make the transition back to good health, because there really wasn't anyone there for me. And so that's what I do.
Thank you. And we're going to hear more about Eugenia's story in a minute. Matt, I'd love to hear from you. What's brought you here today? What made you take the time, and what would you like to see come from this discussion?
Hello, everyone. Thank you. This is a great opportunity. Hearing you name out all the people that are here, I'm super excited. I didn't get diagnosed till I was 40, and then I got another sleep study at the age of 45, but I don't even really want to talk about myself. I'd rather talk about my son and my father, and the fact that this is hereditary for my story, for our story. And it's completely ruined our lives. They don't realize it. They're in denial. I got a little quality sleep in me, and I'm a completely different person. And it's amazing. Quality sleep is amazing. And if me, my father, my son, if we were diagnosed when we were infants, we would have different lives. And we all took medication when we didn't need to. Yeah, like I told you guys earlier, I'm very pro medication. Get a sleep study first and find out if you really need it. It's super hard. There's so many variables that go into it. So yeah, I've just, ever since I got some good sleep in me, I'm a completely different person. So
yeah, and so I think we're gonna want to hear more about sleep apnea and your experience, but also your family's experience with that too. Elizabeth, what's your intention for today? Tell us what your interests in being here are.
So as I've gotten older, I've gotten, I guess, more comfortable with trying to break down the stigma associated with being really honest about your own mental health and how it impacts your life. My sleep's been impacted both by my physical and my mental health, particularly my own relationship with medication for my mental health. And I really want to try to break down those stigmas, because the more we don't talk about it, the more we don't talk about how these things are impacting us, the more we're perpetuating a stigma ourselves. And I was really inspired to see people are tuning in from the behavioral health, because you understand exactly how important this is. Like, I'm not ashamed that I have depression. I'm not ashamed that I have ADHD. I'm not ashamed that I have minor PTSD or anxiety, or that I'm a survivor in different ways. And I think it's really important to sort of be as vulnerable and transparent as possible, so that when we're in positions where you only have a few minutes with a doctor, sleep isn't necessarily considered a back burner topic, because it's the sort of alpha and omega of our health. It's something that determines whether we have a good day or a bad day. And I think it's something that's really important.
That issue, and thanks Elizabeth, that issue of it being a back burner kind of component to our health, that's something that throughout the series so far keeps coming up. And yet once we start talking about it, the urgency around sleep is becoming clearer. But you're right, it doesn't always come up as the first thing. And maybe that's where we can start. Eugenia, could you talk a little bit about how you first learned about your own sleep needs and what that journey looked like? How did you learn what was needed?
It was a mess. I had developed sleep apnea. We're going back over 15 years ago. So what they knew about sleep apnea then was that it was an old man's disease, literally. I was not old and I was not male. So it was not on the radar for me, even especially in its earliest stages. But even as it got worse down the line, I mean, I got to the point where I was rolling out of the bed, I was sleepwalking, I had narcolepsy, literally. I couldn't sit at my desk at work without falling asleep. My commute back and forth to work was less than 15 minutes. I couldn't make the drive without falling asleep. Um, like I said, it was a mess, and no one got what was wrong with me because I was fairly young. I was very healthy, active. I didn't fit the criteria. I wasn't male. I wasn't old. Okay. I wasn't heavy because I was active, played sports. Okay. As well as very busy work life. It just, it took its toll. It took its run because while the doctors saw red flags and whatever, that was not on the radar for a person like me. So it went its farthest until it created the perfect storm for other co-occurring health issues to mount. And all of that together created the situation of my health completely crashing and my becoming disabled. And it was at that point that going back and forth to the doctors, be treated for the co-occurring issues, that professionals noticed the fact that I could not stay awake for 30 seconds, okay? Because I would literally come in the office and sit in a chair and I'd drop off to sleep so fast that people would think I died because I would literally sit down and then drop away. And so finally that led to me having a sleep test and then finding out that I had sleep apnea as well as everything else that was going wrong.
I mean, it's remarkable that, there's not a clear, like you said, you didn't fit what the profile seemed like.
Not at all. I was in my late 30s. At that time, I weighed 165 pounds, tight, fit, muscular, okay, female, nothing fit the criteria. The criteria at that point was old male. I wasn't any of that. Yeah. So it wasn't on the radar. And I remember partners saying to me, I remember what relationship I was in, and when my first partner said to me, you stop breathing at night. And she didn't know what to make of it. And so I certainly didn't know what to make. I mean, what does that mean? What do you mean I stop? You stop breathing, you die. I'm not dead. So we didn't know what to do with that. So we did nothing with it. And when I went to the doctor for my physical, everything else was whatever. I do remember every once in a while, the doctor would ask me about something that wasn't on my radar. So I knew they were seeing something that wasn't quite right, but they didn't, like I said, it wasn't on the radar for them, for me, and I didn't know what it was they were looking for.
All right, thanks. And so we're gonna circle back to this, but we could see how it, and I think in the case of particularly sleep apnea, and we'll talk about that actually in our next episode around some of the sort of diagnostic factors. But I think this is not too uncommon, and to sort of go through this journey. Matt, how does this compare with your experience? How did you kind of find out?
I did fit the mold. I did fit the mold. I was between 300 and 350 pounds for many, many years. And my, I hold the world record for snoring. It was so bad. My ex-wife, that's what happens a lot of times. She couldn't handle it no more, She said, I stopped breathing, I'm snoring. I ended up in the other bedroom. Which of course led to our divorce. But yeah, I fit the mold, and at the age of 40, that's right when everything started falling apart. But yeah.
So you, so it was noticed then you had a sleep study at some point.
I had a sleep study when I was 40, and I was learning out that I mean, I'm permanently disabled. It's invisible, like Eugenia. I have a bad back. So I got the sleep study. I didn't want to wear the machine, the common reasons. It's a pain in the butt. I didn't know. I mean, I was sick too. Like, I didn't realize the whole mental health aspect of it. And I lost my job. I'm on deck for these surgeries, and I had a whole lot of surgeries, and I returned my machine because I had started to lose weight because of weight loss surgery. I didn't want to deal with the machine. I kind of knew it worked a little bit, but I'm in the other room and my life's flipping upside down, and it just was not a priority. And an insurance company said, hey, you're not using it. You need to return it. And so I did the very next day. I didn't tell my doctors, and that was a huge, huge mistake on my part, because all of the surgeries led to me taking opioids. And that was another factor with my ex-wife. She thought I was abusing my pain medication, and I knew that I wasn't. And luckily I found out her concern, and I took all my meds into my doctor the next day and got validation. But he didn't know that I wasn't using my CPAP mask. And so come to find out years later, fast forward, just so you know, opioids can cause something called central sleep apnea, which is the communication between the brain and the heart. So regardless of my obstructive, whether it was obesity or bone structure from hereditary, even if I don't even have that at all, the opioid itself gives me central sleep apnea. And so, yeah, it's real easy to assume that, hey, he's got a pill problem. This guy's messed up. Da, 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 da. I'm thinking, man, I am not. Like, I don't know what's going on. And then, here it is 10 years later. I'm on the same medication. I've completely turned my life around. It's unbelievable. I can breathe when I sleep, and I get oxygen to my brain, and that's all I needed. And I was able to reverse heal from brain damage with ASV treatment. I thought it was just obesity. I lost weight. I lost 140 pounds total early on. It was real fast. And so anyways, yeah, I gave up the machine, just like a lot of people do. It's very typical. But I'm here to say that, it's a complete, I found the root cause for myself. I wish that my family would, but that's on them. I can only do me, lead by example. And I'm literally changing lives because people are saying, hey, I got tested. Now I know. Some people just, hey, I do have just insomnia. I don't have anything else. Well, now you know. Yeah. Good job, because it's that unknown. It's real scary. So, and it's all, it doesn't matter who voted for who, or we all sleep. It doesn't matter what country you're from or nothing. We have it all in common. And there's a huge connection between sleep and mental health. So,
yeah. And you bring up another good point. And you mentioned some of the surgeries and pain medications, but you had some back injuries that kind of commingled with what was going on with the sleep apnea too.
Well, that's why I thought that I couldn't sleep, is because of the pain. That was the whole time. Oh, everybody that knew me is like, even on social media, I remember a friend saying, don't you ever sleep? I'm thinking, it didn't matter how much sleep I put into that sleep bank. It wasn't quality. It was actually working against me because I'm stopped breathing in my sleep. Everything's got to work overtime. And so, yeah, no, I always associated my sleep with pain. And now, yeah, tonight I'm going for an hour-long 2 MRIs. I'm on deck for another surgery, and which is a good thing. But I'm just a completely different person. I know I'm not going to die in my sleep. And, a lot of people aren't doing surgeries no more unless you get your sleep tested first. So it's good to be ahead of the game, get tested, because you never know when you're going to fall down the stairs like I did and need a surgery. I have friends close to me. They couldn't get I even have a friend, he couldn't go into a certain drug treatment program because he didn't have a sleep study. So it's nice to hear things are changing and stuff, but yeah, I can only speak from experience, and I have a lot of pain. I have to take meds. I don't want to take opioids, believe me. But I don't have a problem with them. I'm not abusing them. And I love that I have validation. My doctor team, I love them. Thank God for them, because I didn't know what was wrong with myself, and my friends and family, they really didn't know what was going on. And so I found the missing link, the missing piece to the puzzle, and it was quality sleep. And yeah, I'm very, very thankful.
Also, Matt, you brought up something very significant about how in the beginning, the provider complained to you about you not using the machine at the time and telling you had to give it back. And that's a very common thing. And the answer in that equation is not to tell you to give it back. The answer in that equation was to encourage you to use it, because that was a very important component to improving your health. And that is a very common thing that happens. It's a very different experience, and it does take some getting used to. So everyone kind of reacts adversely to it when they first get it. Okay. And the answer is not to look at the numbers and say, oh, well, you're not using it, give it back. The answer is to help that person learn how to get used to using it so that they can improve their situation. And the providers do that all the time. They're very quick to tell people, give it back. Now, I don't know what is going on their end, but caregivers need to be aware that when you start hearing that chatter, that you need to encourage your patients, okay? No, do not give it back. Tell them to back off. Let the physicians know that this is going on, because a lot of times, by the time the doctor, what did Matt say? His doctor didn't even know he wasn't using the machine. He wasn't using it because he didn't have it anymore, because the provider told him, give it back. Yep. This is something that needs to stop.
Yeah, this is important. I'm gonna come back to this, because I think I want to have I think we need to kind of highlight specifically some of the messaging here of what practices tend to be commonplace that don't help and actually walk us back in terms of progress. But we've been talking about sleep apnea, obstructive sleep apnea, and Matt, you described central sleep apnea, where it is kind of more centralized within the nervous system and less kind of a structural issue. But Liz, it's not just sleep apnea, right? Tell us about your experience. How did you find out about your sleep needs, and what does it look like for you?
So actually watching Vanessa's story, the adolescent perspective really resonated with me. I didn't really sleep when I was in high school because I had undiagnosed ADHD. So I kept myself really busy so that I could feel like I was actually accomplishing something. But then I would wake up at 5 o'clock in the morning so I can finish my schoolwork, because of the fact that I wasn't able to focus enough to be able to get it done the night before. And as a result, my physical health deteriorated. I have chronic IBS, and I was self-medicating with Pepto-Bismol like nobody's business when I was in high school, because my stomach hurt all the time and I couldn't figure out why. And I didn't really think about that until I started watching Vanessa's story, because hindsight is 20/20, right? But my intentional relationship with sleep really started in my early 20s, when I was working in similar positions to a lot of the people who are watching this video. I was an AmeriCorps volunteer working in a runaway homeless shelter. And my depression got really bad the more stories I was hearing from my residents. I started to lose faith in humanity because of the things I was hearing that parents were doing to their children, and it was really hard. And at that point, I had already been diagnosed with seasonal affective disorder. I was living in Rochester, New York, so the sun really wasn't out that much, and I wasn't getting a lot of vitamin D. And I was doing everything I possibly could to make my depression better. I was regulating my sleep schedule. I had alarms set so that I could make sure I was going to bed and waking up at the same time every single day. And that was really hard because of the fact that when you're working in a shelter environment, you don't necessarily have a 9-to-5 work schedule. I was working 8 to 6 one day, I was working 2 to 10 another day, I was doing the overnight shift another day, depending on what the need was. And my sleep schedule never caught up after overnight shifts. I actually will always hold it over my niece that my sister-in-law had her after I'd finished an overnight shift. So I was about to fall asleep, my phone rang, and I was just like, I guess I'm going to the hospital because Reagan's coming. So that was a very pleasant and unpleasant 36 hours. I guess moving forward, when I finally did get diagnosed with ADHD, my relationship with sleep had to change again because of the fact that I was now on stimulants, and I had to start setting alarms, making sure that I was taking my medication at the same time every day so that I could actually fall asleep at night. And as I got older, I was finally officially diagnosed with depression. When I was working in the shelter, I started having suicidal ideations, and it really freaked me out, and I was doing everything I could to prevent it, but they finally decided it wasn't seasonal, it was just happening all year. And they put me on antidepressants that gave me incredibly vivid dreams, and I wasn't having quality sleep anymore. And as a result, that ended up having medicine non-compliance, I think is what it's called. I was getting really nauseous from the medicine because of my IBS. So I was trying to spread it out over multiple days because I knew it had a long half-life. And then I started forgetting that I wasn't taking it. And then before I knew it, I'd gone cold turkey off my antidepressants, and I was wondering why I was having depressive symptoms again. And it occurred to me that I wasn't taking my medication correctly. And similar to Matt, I have chronic pain because when I was training for a triathlon a few years ago, I got hit by a car while I was out running. So I've got damaged ligaments along my neck, and depending on what I do, I can throw out my back really easily. And if it's flaring up, it gets really bad. I had an IBS flare up a week ago, and I couldn't fall asleep because of the fact that my stomach was killing me. It was really awful. I had to wait for pain meds to kick in before I could actually get any rest and wait for the pain to go away. And there are different things that sort of feed into it. I have, because of my depression, I have a really escapist opinion. I'm really prone to escapist behaviors. And while I've never fallen into substance abuse, I do have video game addiction. And simulative video games are really attractive to me because it's a place where I can control the world. And it allows me to create something that I'm happy with. When I feel like my life is not necessarily doing that. It got really bad at the beginning of the pandemic, and I would find myself doing a lot of the things that addicts typically do. I was hiding my behavior. I was ashamed of my behavior. My husband was really concerned, and I would find myself waking up in the middle of the night, and I could only think about the fact that I wanted to know what I can progress within the game that I was playing. And it was interrupting my sleep because I couldn't fall asleep because I was just thinking about that. So there are a lot of little things that are all pretty normal, but when they all add up, it creates this idea where you're realizing that if you are sleeping, it's not quality, and the quantity doesn't really matter if you can't regulate it.
Yeah, I think that, like you said, it's not just one thing, right? The way these sort of what would conveniently be like separate little boxes of our life and come together in reality, it makes it pretty complicated, it sounds like, to manage sleep. You mentioned the medications for ADHD, obviously, having to time those carefully, so to consider their impact on your sleep, antidepressants, and how that could either sort of sometimes, I know people experience either sometimes more sleep or less sleep, and it can make it confusing what time of day to take them. And you mentioned kind of, it also, some of these things interface with IBS and with your stomach and some of the comfort there. And you also talked about practical issues in work, right? And I think this, I suspect that, many of the folks who are on here, who do shift work, to provide care or for other reasons, we know that's a real complication. So it sounds like these things all sort of swirl together, and I suspect it was really complicated to figure out how to manage all that.
I'm going to be trying to figure out how to manage that my entire life. But the only doctor I have who actually asks me how my sleep is going is my psychiatrist, and it's because he's the one who's prescribing me Adderall. And my answer is always the same. It's always like, it's fine, I guess. Like, I'm managing it, and we sort of have this like understanding where it's like a haha, yeah, no, it sucks, but what you gonna do? Are you gonna focus today, or are you gonna be able to fall asleep before 2 o'clock in the morning? So
yeah, and I wonder if that, it reminds me of, that statement from earlier about, is it a back burner issue? And it's sort of, and I wonder if that, does that kind of compare with your experiences? Matt, you had that sleep study at 40. There were other things going. Eugenia, you mentioned it was kind of a longer process to get things figured out. And it was that visual, Eugenia, of you kind of nodding off in the waiting room is striking. I think probably a lot of us have seen that in folks that we work with. Any advice for how to bring sleep health to the front of the conversation? How do you want it to be brought up? How do you, when there are things going on, when you're in pain, when we've got other conditions, physical health or emotional, mental health, how should we be talking about sleep?
Directly. We should be talking about it directly. Okay, I have other health issues. Okay, and when I, for instance, my primary care, okay, he'll ask me about how the COPD is doing. He'll ask me about how the AFib is doing. Okay, he'll ask me about these things. He never asked me about sleep. And neither do, in relation to, on the rare occasion that someone discusses with me about the pain that I go through because I have rheumatoid arthritis and I have osteoarthritis and I have it extensively throughout my body. Occasionally they'll ask, is the pain affecting my sleep? Okay, but professionals just really don't talk about sleep. They don't ask you about sleep the same way they will ask you how your vision is, how your hearing is, how your body pain is, how whatever co-occurring health issues you have are. They don't ask about sleep. We need to be direct. It needs to be on the radar. It needs to be on the checklist. When you ask me about what's going on with me, you need to be asking, how is your sleep? It just needs to be there. If our medical technicians and professionals are not asking us about it, how are we going to expect people to feel like they need to worry about that? They will ask me about high cholesterol. They will ask me about diabetes. They will ask me about all of that good stuff. They will never ask me about sleep. Why? Why is that not happening?
And Eugene, I think on that point, I think it shouldn't just be how is your sleep, it should be guided questions about sleep. Because I think if you ask someone who doesn't know how their sleep is supposed to be, or how they're supposed to be feeling, if you just say, how is your sleep? The answer is always going to be, oh, it's fine. It's the same it's always been. If you're not asking, how long are you sleeping?
Right.
Are you waking up feeling refreshed, or are you waking up still feeling exhausted?
Right.
Are you feeling like anxious as you're trying to fall asleep? Like those kinds of things are really important.
The last time you went for a physical, what did they ask you about sleep?
Physical? I don't think she did. I think that she asked me about literally everything else.
Why did that happen? Why did that happen? Why didn't she ask you about that? Because guess what? I was probably about your age when my sleep apnea started.
Mm-hmm.
Okay? And yet, look at the mess that I am at the point that I'm at now, and they are not preventing it for you. They still haven't learned, because sleep is not part of the conversation for good health by medical professionals. I'm not talking about us. I'm talking about medical professionals. How is that working?
And I'll invite, we're getting some good, we're getting a lot of like amens, yes, like this is what needs to happen in the chat. And I'll actually invite, since we've got a lot of, our audience is largely health professionals in here. So I'll ask folks in the room to also type in here. What do you see as the barriers? I mean, Eugenia, Elizabeth are bringing up good points. Why aren't we asking about these things? I have my opinion.
Definitely be on this. Sleep is it is a pillar of good health, and it definitely affects mental health. Because I got to tell you, while I was going through, I told you about not being able to make it home or to work. I told you about rolling out of the bed and sleepwalking. Okay, but what I didn't tell you about was my irritability. Because being that exhausted, you have to know. I tend to look like this very serious, don't mess with her type person, but really, I'm really a big teddy bear. Children and animals know this. My most meanest face that I can make, if there is a child or an animal around, they will out me every time because they come right over and hug me. She's a teddy bear, don't worry about it. But the truth of the matter was, while I was going through that, I was a bear. I was irritable, I was angry.
Yeah, I mean, on your point about mental health, like I started really thinking about sleep because my depression was getting really bad. Okay. And I whenever I'm confronted with any kind of health problem, I always try to like weed out as many things that might be contributing to it as possible before I ask for help. So when my depression was really bad, I started exercising every day. I got really into my diet. I was eating a lot more fruits and vegetables, drinking a lot more water. I was regulating my sleep schedule and it wasn't going away. That was when I knew I needed help. When I found a lump in my breast, I like cut out caffeine. I waited for my menstrual cycle to pass, like all these different things because I wanted to know, is this hormonal? Is this something that I'm doing to myself? Or is this something that's just there? It's so important, I think, to think about the fact that sleep is a contributing factor to so many other things that people are facing every single day. And before we just throw another medication at it, or before we just tell people it's not that bad, let's think about what's contributing to it. Like I knew very well when I was in grad school that if I wasn't keeping a really strict schedule and making sure that my sleep schedule was really regular. And this is still before I was diagnosed with ADHD. I was diagnosed with ADHD in my mid to late 20s because women in general are not diagnosed when they're younger because we don't present as hyperactive. I was diagnosed when I was in 4th grade and given an IEP for learning disorders or learning disabilities. That's not helpful.
Right.
But then I was... Yeah. So I think it's really important. Like my focus is better when I sleep. My depression is better when I sleep. My anxiety is better when I sleep. Everything is regulated a lot better when I sleep.
Yeah. And Elizabeth, what's remarkable about what you're describing is the systematic approach that you've taken to, like you said, like you'll do this on your own. You'll kind of weed out these different potential contributions. I think a lot of people don't have the background knowledge to do that. Matt, I know you've got your hand up. What's been your experience?
I just wanted to touch on the physicians and doctors. They have such a full plate going on. I don't really think that they should have to be asking you about your sleep in the sense that you should already be seeing the sleep doctor. I think it should be completely separate. I think I should be tested when I was a kid. Like I said, our lives would have been different. Elizabeth, I believe you told me before that you're correct. You have not had a sleep study yet. I mean, based on what I've learned, I mean, there's a chance that if you did have a sleep study, you might be surprised that you might find a root cause down in there. And I'm only saying that based on over the last 4 years, everything you're telling me, you're saying there's a chance. Like, just maybe look into it. That's where I'm very passionate about that because I myself have assumed and it's super, super hard to diagnose. And so I don't think it should be put on the doctors. I think this is a lot, with all due respect, like they got so much, it's so hard. And then all the time, Elizabeth, you said that you tried this and you tried that, you're trying this. I don't have time for that. I need you to be able to be better than that, sooner than that. I want you tested, and that's just the obsessive in me because I think it's that important. So,
Yeah, I'm just a very type A person, so I always try to do as much research as I can before I actually go into the doctor's office. But all of this
Yeah.
has been motivational for me getting a sleep study post-COVID.
You shouldn't have had to
Nothing
do
wrong
that.
with
You
being
shouldn't have
pro.
had to do that. You shouldn't have had to take your time to. That should have already been established, and the ripple effect worldwide would change. I mean,
And
period.
And for folks who you know, I think this is probably raising a lot of interest in sleep studies and in sleep health in general. And so for folks in the audience, our next session we'll be covering more about what are the clinical questions that, if we can, we should be asking to, you know, to some of the points that our panelists are bringing up. And then what does that look like, sort of the transfer? How do you get folks in or a portable sleep study, and then the treatments? But that does get to something that I think is a really important perspective. So let's say that whether we're, you know, I'm your primary care provider, I'm your behavioral health, or whatever, I'm your peer advocate or someone else, and you know, we ask the right questions, and we help you to identify the connections here, whether it's something related to sleep apnea, if it's a complication of medications or other sleep issues, if it's something insomnia or sleep apnea or something else. I think there's something that I think is helpful to hear about, and that's sort of like, once we get that part sorted out, what is the sort of daily life? What does the maintenance look like for that? And particularly for when it comes to sleep apnea, you know, Matt, you mentioned, you described the mask and how some people don't want to wear it, right? So there's multiple, and I'm saying this more for our audience, we have different people come from different places. Once someone's diagnosed with sleep apnea, typically there's a number of different treatment options. There's everything from implantable electrodes to masks that either fit over your face or over your nose or your mouth. And there's even newer, different emerging technologies. There's oral appliances, there's a whole bunch of different sort of options. But you know, Matt, maybe you can share your experience. So let's say I've got you prescribed for that. I've got you set up with your equipment. What does the routine actually look like on your end? So you've got the machine. How does that go?
Well, there's a huge adjustment period for a lot of reasons. I mean, and it's just figuring it out and sticking with it, and it's really hard. And maybe that's part of the reason I gave up and quit. But the mask itself, like, come to find out, early on, I wanted the nose mask, you know, less invasive. You can barely even see it. That's all I wanted. Well, come to find out, I'm a mouth breather. I have to have the full mask. Like, I didn't even know there was a difference. And so people don't want to wear the mask. It's not sexy. It's just a pain on the butt. We don't want it. So yeah, there are other ways, the mouth guards, and there's the Inspire implant. You know, the CPAP mask is the gold standard. I love it. It works for me. But yeah, there's other options for sure. We got to clean it and, you know, change the filters. That can get dirty real quick. So changing the, you know, definitely have to keep, and that's why you see the doctor every year, and you get your supplies. You know, you gotta keep it going. I've talked to way too many people that have their machines. Oh, it's in the closet and stuff, and it's like, no, we got to get that out, and it's got to just be part of the system. But people give up too easy because there is a lot to it. It really can be. If I have a mental disorder and I'm like, I can't even pay my bills, and I'm like spun out, and you want me to like figure out this machine and stuff, I don't want it. And that's even if I went to see the doctor. And that's also even if I was honest with my doctor. But most men don't even bother going in until it's too late. But yeah, there's a lot to the machine, but that's why I'm here for. It's worth it. Like, once you get a little bit of taste of the energy, you know, and it's going to depend on the person. You know, I was really shot out, so I know it was a big difference, but there's an adjustment period, and there, you know, travel. I got to travel with it. I got to clean it. You know, it's just so much to it, and it's very important though. I love it. I went from hating it to being obsessed with it. So
Can't hear you. Can't hear you.
Did it again. And that's so Matt, that's, you know, I think that's something that and I've heard a lot of, you know, in our work around sleep. I think that's a common story where it was a struggle to kind of get adjusted. There is maintenance, but when the treatment works, oh my gosh, like the changes in concentration, you know, you mentioned mood, just sort of feeling awake and energy. It can be really transformational. But you mentioned something that reminded me of in our pre-discussion, Eugenia, you shared a little bit about the experience of seeking care and insurance and after you were no longer working, a little bit about dealing with Medicaid and things like that. Can you share a little bit of how that impacted your experience of getting care?
Yes. I first of all had no clue. Okay, and now I'm in a situation that I really had no clue about, because I'm now relying on subsidies and government health care. And back to what Matt mentioned, okay, because I ran in it too. The provider comes in, the doctor prescribes the machine and the provider brings it, okay, and they do have a nasty attitude about usage, okay, and like Matt said, okay, there is quite a bit to it, okay, because even with the full face mask, which I too have to use, there are different face masks, okay, and you have to find the right size, you have to find the right one because they fit differently, okay, and the right one will give you a snug fit so that you get the full complement of everything. And while I'm trying to negotiate all that, I had so many co-occurring issues that I was not only eligible for Medicare, but also for Medicaid, okay, which is dual coverage. The thing about the Medicaid is that Medicaid is also for people on public assistance. And that is the main process about it. When you are not a senior citizen, which I am not yet, okay? So they saw Medicaid and my age and made the assumption that I am public assistance. And so they are really aggressive about what they will try to shortchange and shortcut, okay? And that was part of the reason that I ran into things. They gave me a machine that was not the one that my doctor prescribed. It not only was not the one my doctor prescribed, it was not even a machine that was being supported anymore by the company in terms of Wi-Fi or anything else. The machine was out of service for over 5 years. And they gave that to me because they saw the word Medicaid and they figured, what would I know? And the doctor would never find out. So I struggled for 5 years because durable goods have a 5-year time limit. 5 years was a machine that didn't work. I was in and out of the hospital with all sorts of COPD issues, okay, because I was using a machine that wasn't working. The sleep apnea was marching on, getting worse because it was not being checked. I got a second, they replaced that machine with another machine that was just as old and just as antiquated. This cycle went on until honestly, I, by chance, ran into the American Sleep Apnea Association doing a survey with the COPD Foundation and finding out about them and coming in contact with them. And I learned, okay, what was going on. And my doctor got in on it. We found out I did not have the proper equipment. And that was the reason why I was in and out of the hospital all the time with these exacerbations from the COPD. We got me back on track, but this is a very big issue. And if it's happened to me, it's happening to millions. And that's a very sad thought. They're not solving the problem, they're creating bigger ones.
And sorry, I just wanted to butt in. I spent a lot of time actually telling people that they're eligible for Medicaid. I spent a lot of time working on advanced premium tax credits with the Affordable Care Act and trying to help people figure out how to navigate their own healthcare. And so many people I've seen who are making so little money, who are eligible for Medicaid, are opting to pay full price for health insurance because of the fact that they know that they'll be discriminated against because they have public assistance.
It happens.
And
That's a reality. It happens.
Yeah, and it's a systemic thing. It's something that needs to be brought up with care providers. And I understand that there's a reimbursement issue, and I understand that there are things like that, but it's so hard from the care side, from the side of the person who's trying to make sure that you're getting the best health insurance that you can get, to watch people who are opting to take a catastrophic plan that doesn't really cover anything because of the fact that there's a shame associated with Medicaid and because they don't want to be affiliated with that. So
and you don't get the best of care in anyway, because they're making assumptions, because they saw Medicaid up front. They didn't look behind it to see the Medicare. And honestly, I feel like they shouldn't be doing that anyway.
Yeah.
Your job is not to decide whether or not I used to be a working person. Your job is to provide the care or the equipment or whatever your capacity is. And these systemic discriminations are going on in their reality. I happen to find that out. Firsthand.
No, I mean, it's a systemic issue, and there's so much stigma associated with public assistance. And I think that a lot of that started in the Reagan years, where the people who were on public assistance were labeled as welfare queens. And it's a huge issue, and it's something that we all need to be addressing. We all need to be trying to break that stigma. And also trying to lobby physicians to actually accept insurance. Like Medicaid is good insurance. Medicaid is some of the best insurance that you can get. And I'm regularly telling people that because of the fact that it covers everything. Like I can't find a health insurance plan that will cover vision and dental. That doesn't exist, but Medicaid does. And like, I'm constantly trying to like build people up and not feel like they're a failure because of the fact that they're on public assistance.
Well, I mean, it works both ways because they're getting that message also from their providers and their caregivers, because the minute they hear Medicaid, something shifts.
Yeah.
Okay, and things become different. Okay, yeah. When I lead off with Medicare, the response I get from people is very different from when I lead off with Medicaid. I generally lead off with Medicare and then tell them as an afterthought, oh yeah, by the way, I have Medicaid. It's a different attitude, and that's reality.
And I think, this is, once we get into, I mean, there's, I think part of what we're highlighting here is the complexity that happens outside of the exam room or outside of the sort of treatment center, right? There's, whether it's sort of the journey to get to treatment or to get a diagnosis or to even just get some sort of treatment or assistance, but then it's sort of navigating, Liz, like you've highlighted sort of conflicting or complicated information around how do I navigate all the different medications that sort of are each operating a different way and have their own unique side effects. Matt, you shared about the actual experience of using, a CPAP or a BiPAP machine, and Eugenia talking about navigating the insurance world. It's like, it seems like a dizzying kind of array of things to get through. That's so much more than just, oh, here's the treatment, sort of take this thing. And I think a lot of the folks in the chat have really been, I think, echoing that. There's, we have a lot of.
I mean, it kind of gives you a glimpse of the reason why you have so many people walking around who, while these things are available to them, the reason why they're walking around not addressing their health issues, they're not addressing it because it's so overwhelming. You literally have to be a social worker to bring it all together. And I'm that social worker, but hey, didn't I do it enough in the 28 years that I was working for other people? Can't somebody take 5 minutes to do it for me?
Well, I think that's, you mentioned the association. I think it's great that there's folks like you who are doing this advocacy, and there's folks who actually, some of the audience in the chat has mentioned, and we're sort of transitioning to our last 20 minutes of kind of our Q&A. So I'll encourage folks who haven't already to kind of ask your questions in the chat. And I'm going to actually refer some of those to us here for the group. But there's a number of people who have really said and actually share their own similar experience where they've struggled to kind of use the CPAP, but also like one of the audience members mentioned, you definitely have to advocate for yourself. Their experience too is the CPAP, the continuous positive airway pressure device, the machine that treats sleep apnea, made a world of difference for them. There was some people, this is a common question, and I'm curious if the three of you have any thoughts on this. Has your experience changed during COVID around sleep? What's that been like? Elizabeth, I saw you kind of nodding, yeah.
Oh, absolutely. So I don't know anyone who didn't have some mental health experience with what's going on in the last year. I was supposed to get married last May. I did get married in my best friend's backyard in June, and we'll have a big wedding someday. Date TBD, but the stress associated with all of that, especially in the first few months, like I wasn't sleeping, or if I was, it wasn't restful. And I have different tricks up my sleeve to like help me get to sleep. Like again, Vanessa, the child who was talking about thoughts racing. I have tricks for getting my head to stop doing that. Like I just write down whatever's in my head and then I can sort of let it go because I'm always worried I'm going to forget things. And my husband had to be on the other side of the country for 3 weeks. And after spending 10 months locked up together constantly, it was really hard for me. And my sleep completely went out the window because my routine had changed. And I think that the thing that's hardest and the thing that has been most important during all of this is establishing a new normal and understanding that while this is completely different than anything we've ever experienced before, routines are essential. Like if my routine gets messed up, my brain doesn't know what to do. And that's the first place where I notice it is I can't fall asleep. I can't get my brain to shut up. I can't pull myself away from whatever it is that I'm doing because of the fact that my group's been thrown off. So that's been, I think, the most helpful thing for me is establishing my own routines within the pandemic and figuring out how to establish some comfort level with what's going on around me.
Matt, you mentioned your family too. I'm curious whether for you or for them, have you noticed changes during the pandemic as far as sleep goes?
I want to mention at sleepapnea.org, we have a lot of videos with some great resources when it comes to COVID. Personally, being disabled, I already stay home. I'm very used to it. And to be honest with you, but if I have my CPAP mask, COVID's nothing to me. Sorry. I was recruited after being disabled and not working for 10 years. I'm so focused and into my own because of reverse healing and my mission. I was recruited to be a moderator from a company called Health Union. Like I said, my life's changing. Nothing's going to stop me right now. And it's only because of sleep. And since you mentioned my family, my son, he 19, he's still wet in the bed his entire life. My father, my mom talked about his mental health issues my entire life. My ex-wife talked about his mental health issues. I finally found the missing piece. They don't want to figure out what's going on, but that's okay. Like I said, it's on them. But sleep's, that's all I needed.
That part's very encouraging, and I want to share a couple of the. I want to share with everyone some of the feedback that we've been getting also in the audience and kind of raising some important issues. A lot of the professionals in the group have acknowledged just the complexities of navigating insurance, Medicaid, Medicare, reimbursement. I think it's probably like the experience is definitely has the biggest impact on folks who are the beneficiaries who are using those types of coverage. But it's also, I do want to acknowledge there's a lot of complexities also on the provider end, and we've got a lot of work to do to make these things add up. We've gotten another comment, not only navigating the systems of care being difficult, but some specific areas where they've seen that too. And one of our audience members just called attention to nursing home residents also lacking sleep, where there's this sort of, and we see this also in, when I've worked in critical care units and hospital settings, where we see this sort of artificial schedule that's sort of put into place to, as part of the way of doing care. Lights getting turned on at night, machines kind of beeping all night. The comment here really referred to some ways that we can actually use very specific natural awakening times that are sort of more natural to reduce some of the problematic experiences for folks with dementia around falls, actually improving quality for older adults. And this person mentioned sleep is the most important thing. So we really need to focus, in situations where not everyone, like in a medical setting, in a nursing home or something like that. She mentioned, we need to get away from waking patients and residents up when they're hospitalized or in their nursing facilities, because that exacerbates everything for those folks too, probably in not ways that are similar for any of us, right? Let's see, we've got, oh gosh, another person mentioning the time zone changes, the spring forward, fall back. We've got that. I think there's another one coming up, and that's difficult. There's a question that I'd like to refer to you, which was any advice for, you talked about and you highlighted the need, and it sounds like we heard a resounding yes as far as sleep is something that should be asked about and something that should be discussed regardless of the setting, whether you're seeing primary care or medical specialty or behavioral health. Any advice for those of us who are in those positions for not only, you mentioned just ask about it directly, but connecting the dots? I think each of you have done this so far, kind of in your own descriptions of mentioning how it relates to pain, how it relates to mood, body functioning, attention, ability to stay awake. Was there any way that either you or other people you work, because I know you're also involved in advocacy and helping other folks, any advice for how do you help people sort of see the connections? Because some people I think don't really want to work on their sleep. They are much more as patients, we can, when we're in pain and things, there's been times where, folks don't want to talk to me about their sleep. They said, they're like, no, my real issue is, I'm in pain all the time. I can't focus. There's all these other things. Any tips for how we help people kind of see that connection or a meaningful way to do that?
Well, I think it's a lot easier now after COVID, because one of the silver linings that came out of the COVID crisis is the fact that we all had to stop and shelter in place. And that created a situation for us to be able to find out how tired we really were and how hard we were pushing it at so far past our boundaries, okay, that at this point, I think people are ready to listen, because they realize there is a point to it that they've been missing. Okay, we're all ready to get back to going again, but we really need to look at that before we go back out into the world and understand that sleep is very important, because you cannot burn that you can burn the candle at both ends, but what happens is you end up with nothing quickly. Okay, and that's just the bottom line. Remember how you felt the first week or two in shelter in place, because I'm pretty sure most of us slept most of that time because we were so exhausted already. Okay, no one complained about having to shelter in place for weeks after it happened, and that wasn't as much about us being fearful as it was about the simple fact that we were asleep. We were so glad to be able to sleep without anybody bothering us. It took about a month or two before we got into the fear part and said, okay, how long do we have to do this? Okay. and we need to look at that. We need to embrace that and remind people, use that as a tool. Remind people, hey, listen, how long did you sleep when you first went into shelter in place? You need to look at that. And when you go back out into the world, you need to be mindful of that, because sleep affects, we heal when we sleep. So if you're never sleeping, anything that happens to you, including a common cold, is going to hurt you, because you're never truly healing properly if you're not getting proper sleep.
Yeah, you're getting a lot of shout outs in the chat of people, like, I think who that resonates with. Elizabeth, go ahead.
So I think a big thing is just empathetic listening. So like, Andrew, you're talking about how you talk to a patient who's concerned about like pain or something like that, and you'd want to make sure that you're trying to tie it into sleep. Acknowledge what they're talking about. Acknowledge that you hear what they're talking about and you want to get to the bottom of it, but also that you want them to understand that sleep kind of gets to the bottom of everything. And it might not be the answer. It might not be what's causing their pain, or it might not be what's linked to something. But the thing is that if you can rule out sleep as a contributing factor, then you can get to a better diagnosis down the road. So I think that just articulating it that way, where it's the idea that you're trying to rule things out, you're trying to make sure that you're providing comprehensive care and like a wraparound, like wraparound services and things like that, like making sure that you are making the patient feel heard and validated, but also understanding, helping them to understand that sleep connects to everything. I think that any parent out there can fully empathize with the fact that not getting enough sleep and not getting quality sleep is going to contribute to everything, because they see what happens with their kids when their kids don't get enough sleep. And that's the kind of thing that you can communicate with your patients and help them to realize that doesn't go away when you get older. We just find better coping mechanisms. Like we have coffee now, we have screens in front of us that help keep our brains alert. We have so much stimulus around us that helps us to stay alert during the day, even if we aren't necessarily functioning at our best, and those kinds of things. And I mean, every medical professional should understand that sleep is a contributing factor to most things that happen to people. Like it contributes to obesity, it contributes to mental health, it contributes to most physical illnesses. Issues. Like I know that my IBS flares up when my stress is high, and my stress is high when I don't get enough sleep. So it's all over the place.
Yeah, I think that's a great point. And there's, and you're right, like there's, it may not be sort of what people are always showing up for. It may not be sort of that, you know, the biggest concern that, you know, when you've got 5 minutes with your doctor and, you know, or your nurse and, or your psychologist, whomever, you know, and you have to sort of, you know, you've only got so much time. So I think a lot of us, like, you know, we're all patients, right? Like when I go to my doctor, I feel this sort of a quick pressure. I don't want to waste their time. I'm like, oh, it's just this. And I'm not going to, I don't always feel invited to kind of really explore everything, but kind of the first step sounds like is asking about it. And then maybe if it's invited, providing some education too. Matt, do you have any thoughts on that? Like anything that you, I mean, you again, like you do a lot of work with other people around sleep too, and advocating. How do you help people connect the dots?
I wanted to touch on earlier, you guys mentioned the discrimination word. Because I hit the streets hard every day. Anytime I do go out, like Walmart, Safeway, it doesn't matter. I'm talking about it nonstop. I'm obsessive. A pilot, a class A, and a class double B, class B, they don't want to get sleep studies because they don't want to be discriminated against. These are people that are driving us and flying us and stuff. And anybody that's driving over 100 miles an hour or taking my son to school on a bus or what, I just, you know, hearing people say, oh yeah, I'm not going to get tested because I don't want to lose my job. You know, a pilot that I know, yeah, he doesn't want that stain on his record and stuff. And so there's just that stigma. Oh, how dare you see, have sleep, you know, it's taboo. We don't want to, you're high risk. Well, actually you're high risk if you don't wake up. You know, have fun killing somebody. You know what I mean? It's like, hello, And that's where I come into play. Like, I'm trying to knock it into their brain. Like, what's more important, you know? So yeah, they're very scared. They don't. And it was a trip 2 days in a row, one day at Walmart, one day at Starbucks, back-to-back days. It was a class A and a class B. And that was never happened, but just an example. Like, I'm always talking to people and stuff. And so it was a bummer. And here I'm saying, no, get the test. So I just want people to know what's going on before you take medication like I did or my son did for no reason. What if I had a side effect from that? You know, like, and all that time wasted for something that I should have already been doing when I was born, to be able to get oxygen to my brain, which I have been deprived. And then I have to be, you know, people expect me to be perfect and normal and live life like everybody else. I didn't know I was in a brain fog until I came out of the brain fog. How are you going to know? So
yeah, and what you're mentioning even, and it reminds me of what we were talking about a few minutes ago around kind of tying in the pandemic, and you know, you kind of each sort of highlighted opportunities there, and I've noticed that too, you know, for myself, but also in my patients too, where there's this opportunity. Sleep may have been a really long-term lingering issue, but suddenly now it's a little bit easier or sort of on the surface to talk about, and so there's these opportunities, but like you said, there are legitimate fears. Like I've worked with like long distance truckers, people who are in the military, active duty. You know, and I think this, you know, our audience, and we've had some of these conversations in the past, and some of our other kind of national dialogues here around stigma in general for getting help, whether it's for physical health or mental health, or these things that are kind of in both realms. If you're what that will do for careers, for security clearances, for, you know, family perceptions, you know, with children, we know, you know, this is a whole other topic, but we're in our last couple of minutes here. So I'm gonna, in a moment, you know, ask each of our panelists here for kind of any additional thoughts or resources or suggestions. But as we do that, maybe we can pull up, our panelists have been really generous in sharing their information. So if folks would like to follow up with Eugenia, with Matt, or with Elizabeth, unless they've changed their mind, I believe you all welcome it. And Matt has supplied this awesome photo, by the way, if for folks who are wondering perhaps what the mask looks like. Matt, that's it, right?
Oh, that's my Amara view. That's my baby. I've been single for like 4 years. I'm putting myself first, and yeah, that's been the only person in my life. I love that mask.
You know, so again, as we wrap here, you know, first of all, thank you again, really, for sharing your stories and also your advice. You know, again, I mean this. You are the experts, and so when we're learning about, and actually a lot of the folks in the chat have been saying this in different ways throughout the discussion, that a lot of us, and I'll say myself included, even with an emphasis on health as a psychologist, we didn't get a lot of formal training around addressing sleep. You know, I learned about, you know, talking about the mask, like I learned about mask fitting and about sleep apnea by hanging out with a few of my patients, actually going to their mask fittings and sort of sitting there, watching some studies, going to the classes. But, you know, it's not always part of our professional education. And so a lot of us, you know, we have good intentions, but things like this hopefully are helping us kind of learn and even see where we might want to go for additional resources. So
sleep medicine is still very new. Yeah, I mean, the CPAP machine wasn't even invented till 82, I believe. And so, like, yeah, this is all very new, and they're still learning, and it's great. Like, we have a lot of great resources. And just real quick, yeah, I'm open. Anybody can hit me up anytime. I'm Sleep Apnea Man. I've been trying to brand myself over 4 years to spread awareness. And sleepapneaman.com, I'm slowly trying to build my website, and over the next few months, hopefully, you know, I'm never going to stop. I'm definitely in this for forever. So I appreciate everybody. Thank you so much.
Elizabeth, any other thoughts or suggestions for folks as we're kind of wrapping up?
I think my biggest thing is that I feel like people take their ability to sleep really personally. Like, if you can't sleep well, you've done something wrong, like you looked at screens too long or something like that. And I think that it's really important to affirm your patients and affirm the people you're working with that getting to the bottom of whatever is impacting your ability to sleep is something that's going to ultimately improve their quality of life, and they aren't a failure if they need help. they're in a failure if they need to access resources to help sleep better. If anything, they're stronger for it because they're taking the active steps they need to get better.
Yeah. Eugenia.
Okay. Feel free to go over to our website, the American Sleep Apnea Association, and it's sleepapnea.org. We have brochures, we have a podcast, we have, how could I forget? We have a blog that I write. We have videos on YouTube. We're on Facebook. We're on Twitter. There's all kinds of information on the main website. And we just need to get this message out. We need to be more supportive of the whole sleep idea, because sleep is life, and that's all there is to it. And just as an aside, I think Sleep Apnea Man is amazing. That's how I met Matt. He is crazy, he is wild, and he's great. So check him out on his website too.
Thank you. You haven't seen nothing yet, girl. Thank you. I appreciate you guys.
And thank you very much for having us. I really appreciate that.
Yeah, thank you.
Thank you all. And again, thank you to, and we can actually, we've got one more slide. If folks have other questions, other ideas, if you want to partner with us in this important work, you can feel free to get a hold of me and our team. Visit us. The recording for today will be posted probably in the next few days here, and we'll send out an email also on pcdc.org/sleep. Is a really easy way to find it. You can also find about other resources and upcoming events. We thank you again. We thank the three of you for sharing your stories, for teaching us. Thank you to our audience. Thank you to SAMHSA and the Center of Excellence, and everyone who's been supporting this work. These are, I think, if it has never been evidenced before, it certainly is today. These are important conversations. We need to keep having them. Thank you, everyone.